Good day to you and welcome to Pharma Logistic Africa panel number 4. I have the immense pleasure to present and to chair this panel discussion where we will have, I would say, the main representatives of the pharma supply chain. So my name is Fabrice Panza. I'm leading the Global Cool Chain Solutions at Etihad Cargo. And it's true that over the last 20 months, we have been very busy, of course, in setting the right collaboration, matching the requirements when it comes to pharmaceuticals, and being sure that we are also aligned together as a community, I would say. Today we have Sanjeev Gadia, CEO of Astral Aviation. We have Jean-Cédric Meus, who's managing the UNICEF supply division. We have Da El Haj Sidi, who's responsible for Chemonix International. And we also have Remo Hanselman, World Courier. We have Anthony Kirunda, who's managing the supply chain systems activity of management sciences for health. So as you can hear, we have lots of very good experts in the industry. And it's a pleasure now to also give the floor to our panelists. I will start with a short introduction. Maybe Sanjeev, if you could start in a few words by introducing yourself.
Good afternoon and thank you, Fabrice. First of all, I'd like to thank GRV Global for hosting this important event. And the timing of this event is really great, especially with the crisis of Omicron. And I really believe that we have a very important responsibility for the distribution of vaccines in Africa. My organization, Astral Aviation, is a cargo airline with a fleet of 14 aircrafts. And we've actually dedicated part of our fleet for the transportation of medical products and vaccines to and within Africa.
Very good. Thanks a lot, Sanjeev. Pleasure having you today. Jean-Cédric, would you mind presenting yourself also?
Thank you, Fabrice, and thank you for hosting this, as Sanjeev said, this important meeting, and really honored to be part of the panel. I am, yes, the global chief of transport for UNICEF, and UNICEF is quite a big actor in fighting the pandemic and trying to deliver as much as possible all the pharmaceuticals to and protective equipment, but also in the role of COVAX to deliver as much as possible all the devices and vaccines around the world to the AMC countries and other self-financing countries. And pleasure to be on the panels with some of our major partners to achieve this objective.
Excellent. Thanks a lot, Jean-Cédric. I would like now to hand over to Da. Would you mind presenting yourself?
Thank you very much. So I'm really pleased to be part of this great panel. I am Da El Haj Sidi. I am the Technical Director of the Global Health Supply Chain Technical Assistance Francophone Task Order. It's a USAID project implemented by Chemonix International. So the goal of this project is to strengthen supply chain in Africa, mostly Francophone countries, to ensure timely access to quality essential health products and services, of course. So I'm really pleased to be part to share our experience in DR Congo in the integrated last mile distribution. Over.
Thanks a lot, Da. Very clear. And as we go along, we can see that we are really covering the full supply chain, which is, of course, very interesting. Dear Remo, over to you for your introduction.
Thank you very much and good afternoon to everyone. Thanks for having me on the panel. My name is Remo Hanselman. I'm the Managing Director of World Courier, South Africa and Kenya, with the remit to further grow the footprint in Africa for World Courier. World Courier is a specialty logistics company focusing on medical logistics for global clinical trials and commercial medical supply chain. Besides others, we offer GDP compliant cold chain transport solutions globally, and we are part of vaccine distributions in several months now since the beginning of the pandemic, and have helped distribute several millions of vaccines within the continent, and I'm interested and thankful to be part of that panel.
Pleasure having you. Thanks a lot, Remo. Now we will go into a discussion where we will focus, of course, on Africa and pharma supply chain logistics stakes. I would like to give some background that we are all aware, and we have UNICEF also with us today, who can, of course, testify on that. During the last months, in terms of delivery, we saw an important delivery of the COVID-19 vaccines, for instance, but mainly focused into very few countries. So when it comes to Africa, we know that we have still a lot to do in terms of distribution. And maybe I would like to hand over to you, Sanjeev, on this question for Astral Aviation. What is your role into this global distribution, and specifically, of course, in Africa?
Thank you, Fabrice. We are a part of the Humanitarian Air Freight Initiative, which was set up by UNICEF to transport the COVID-19 vaccines in Africa. And I'm truly grateful to UNICEF for giving us the opportunity of being of service for the transportation of the COVID-19 vaccines. And we've already done a number of shipments to very high-risk regions in Africa and also into Yemen on behalf of UNICEF. But we've also done a lot of transportation for the African Union for the COVID-19 vaccines. And I also wanted to thank Remo because we jointly participated in the transportation of 1 million doses of the AstraZeneca vaccines from South Africa to approximately 18 countries. It was achieved in 4 days. Now, we have a collaboration also with Hope Consortium and again with Etihad. And Fabrice, I would like to thank you and your team for the collaboration. It is through collaboration that we are going to be able to move vaccines to and within Africa, because Africa has a number of challenges when it comes to the logistics and the last mile delivery of the COVID-19 vaccines. And I think the biggest challenge that we have to accept is a lack of infrastructure. Only 5 airports in Africa can actually handle vaccines and have access to handling facilities at the airports. And these are only 5 airports out of a total of 54 countries in Africa. So this is a very, very big challenge that we actually have in Africa, which is a limited amount of infrastructure at the airports. In addition to that, there is a lack of training. There's a lack of capacity for aircrafts and also for handling. So how do you move a consignment of, let's say, 300 million doses of vaccines to and within Africa? This is a very, very difficult exercise, and it's only through collaboration and cooperation with all the members of the supply chain that we can actually be able to undertake such a huge responsibility. And again, we have a number of partners that we work with, and we really believe that despite the problems that we have in Africa and also the big challenge of expired vaccines, we believe that it is through a collaborative approach that we will actually be able to solve the equitable access of the COVID-19 vaccines to and within Africa.
Thanks a lot, Sanjeev. Thanks a lot also for your word. It's true that at Etihad Cargo, we were extremely pleased to have this partnership being signed between us. So we have concretely what we have signed is a former service level agreement between our 2 airlines. And we do also, of course, believe into this collaboration and partnership. During your replies and clear answers also on all these challenges, I would like now to hand over to Jean-Cédric, because I guess you are really in the middle of this distribution, but also facing all these challenges. And we've seen you acting as UNICEF within the COVAX organization, also trying to collaborate as much as possible, but also facing, as Sanjeev was saying, some infrastructure and handling issues. So my first question to you, Jean-Cédric, is linked to that. How did you navigate in order to find a response for this global fight against COVID-19?
Thank you, Fabrice, for this question. I think, first of all, let's backtrack a little bit. UNICEF is on a regular basis, outside COVID, shipping more than 2 billion doses of vaccines around the world. Africa is definitely one of our first destination, and we are supporting most of the Ministry of Health through Gavi with WHO for routine immunization activities. And over the years also, it's not only the vaccines, but it's the devices and also the equipment. We had a project with CCO, with Gavi and WHO is the cold chain equipment project to renew the equipment on the ground. So we have that expertise, and that's why when COVAX decided when basically Gavi and the Alliance decided to step in on the response for COVID and create the COVAX Alliance, UNICEF became one of the major stakeholders and to procure and to deliver together with PAHO, because PAHO is delivering all the COVID-19 vaccine in Southern and Central America. So looking at this, while we were working on the first response of COVID for the equipment and the protective equipment for the population around the world, we established a large collaboration with partners. As Sanjeet said, we had an industry consultation, which resulted in different partnerships with HOPE and with different partners on the industry to make sure that we would not interrupt and that we maximize all the resources available in the world, considering also the shipping turmoil that we are facing. We have, as Sanjeet said, we have a new variant, but disregard the new variant, the industry is congested, the industry is facing an unprecedented turmoil. So maximizing all the opportunities was really our objective. We have agreement with the World Economic Forum, we have agreement with 16 airlines and numerous carriers, and that allowed us to prioritize everything that is COVAX related supplies. Up to now, we have achieved all our objectives. We have more than, we're working also with the African Union and AVAT on this, looking at all the supplies that we can share. When we have achieved quite a large amount of deliveries, we are above for 560 million vaccines that have been delivered around the world. And on the African continent, we have delivered COVAX and African Union vaccines to most of the countries up to now. This is only a small segment of our response because the largest volume are definitely the devices, and definitely all the partners around this panel are always welcome to continue supporting this effort, this global effort, because nobody will be safe until everybody is vaccinated.
Very clear. Thanks a lot, Jean-Cédric. I guess, yeah, you were mentioning few challenges also, and you were also reminding that the scope is not only the vaccines, but everything that is needed before the vaccines. You were talking a bit about storage, which is an important element, but also about the importance of distributing the right PPEs, let's say. I would like also to ask you back, Jean-Cédric, a question on precisely nowadays in Africa, what is the most, for you, what is the most pressing challenge that you're facing?
The challenge is, the upstream challenge is first of all the availability, the making sure that there's an equal distribution of all the different equipment, protective equipment, vaccines and devices. That's the first one. The second one is to reach the central level, and then to make sure that the campaign administration is well organized and that we are not keeping the material too long at the central level. But of course, the industry turmoil is not behind us. Sanjeev and other, and yourself, Fabrice, know better the situation, and we believe that 2022 will still be the same than 2021. So the prioritization of airspace to reach the central level, all the countries in Africa, is for me the most important one. And certainly, as Sanjeev said, we see now in Southern Africa the new variants. As a consequence, some countries start to be landlocked, as we saw in 2019, and that will increase our constraints. Still, I believe that now the industry is a little bit more prepared, and definitely this coordination that we can see, as an example, this panel also, but the coordination and the effort, the joint effort to prioritize everything that is related to fight, all the supplies that are related to fight COVID-19 pandemic is welcome, and there is a conscious, and that is really appreciated by all the different partners from the private sector. So yeah, it's upstream and downstream, definitely still a lot of efforts are in front of us.
clear. Yeah, and you're right to remind also that we still have a lot to do. And when we look at the big picture and the figures and the projection for next year, 2022, 2023, according to WHO, the projection of COVID-19 vaccine is going to reach 22 billion per year in the next 2 years, knowing that we have delivered something like 8 billion in 1 year, maybe a bit more at the end of the year. So for sure, we will still have to face these challenges. And there is one point, Jean-Cédric, that you've just mentioned, and I would like for this question also to hand over to Da. When it comes to global distribution, we have been talking a lot now about air distribution and air transportation. I would like to have your advice, but also your feeling on how you could describe the last mile distribution in Africa. I guess you have some experience on that that you would like to share.
That's right. Thank you very much. So what I want to share here is our experience within Chemonix International in terms of last mile distribution and what we call the integrated last mile distribution. And that's what we piloted in DRC. And you know, DRC is a very big country with not optimal road conditions. So it's really, distribution is really a challenge. So after like assessment conducted by Ministry of Health and USAID field visit, we said, we implemented this integrated last mile distribution in two provinces, mainly in the Haut-Katanga and the Lualaba provinces. And after these findings from supportive supervision or USAID field visits showed that really the supply chain is fragmented with multiple storage locations and with many supply chain actors. That's led to increased delivery lead time to service delivery points and increased distribution cost, of course. The stock out is of course there, and the suboptimal storage conditions. So we decided, okay, how can we really optimize the distribution, improve the operations, reduce the cost, and on top of that, reduce the stock out, improve the product availability, which is really our goal, is to ensure timely access to quality essential health products at service delivery point. So what we did is we developed a distribution plan. We developed, of course, detailed budget for the activities, and we defined the timing, the health zone, or in other countries they call districts, the health zone that will target the staff that will be involved in terms of handling, in terms of picking, but also in terms of providing some kind on-the-job training when we are delivering product, and the duration of this activity, because we know that in the normal circumstances, when the distribution is conducted by the regional medical stores, it takes like more than 14, sometimes months to distribute product to service delivery points. We decided let's do it in 10 days and see. So, and what was also beneficial for this activity is that the packing was done at the regional medical store, not at the health zone stores. So, and we conducted it, it was a success. I will share later the results if you want, but that's exactly why we did it and how we did it.
Okay, very good. Thanks a lot, Da. When it comes to this distribution and anticipation also, so before Jean-Cédric from UNICEF was saying that the collaboration is key, I guess Sanjeev, myself, of course, we are recognizing it as being very important within the pharma supply chain. And there is now a question I would like to ask to you, Remo, based upon your experience in Africa. How do you play an active role into this distribution? And I would say even how far the collaboration is contributing to the good distribution despite the challenges that we are raising nowadays?
Yes, thanks. World Courier has a proven track record of connecting treatment to patients and advancing healthcare during challenging situations. And we're present in Africa since over 40 years, not only in South Africa and in Kenya, but also in the rest of Africa with our partner network. And we have experience from the HIV and AIDS crisis to the outbreak of Ebola in West Africa. So from that point of view, when South Africa went into full lockdown in March 2020 last year, like the rest of us and the world, we as an essential business have operated throughout this time. We offer a crucial service to store, warehouse, and most importantly, transport investigational drugs to clinical sites and hospitals. So we have pretty much been involved from day one in the pandemic and have subsequently supported the logistics of various COVID-related trials at the beginning in South Africa, and now obviously the rollout of that vaccine and across the continent. With facilities in South Africa and Kenya, as I mentioned before, and the large network, we are very much positioned to help support this endeavors. And in answer to your question, our strong established presence in South Africa and Africa, combined with experience of over decades, has naturally positioned us as a trusted logistics partner in the medical industry for the vaccine rollout. So help coordinate airlines and support last mile delivery and supporting regulatory aspects as well, because that comes on top of it. So we have been involved in various projects like the one Sanjeev mentioned earlier. And I just want to make a quick reference to the keynote presentation I'm holding at some point as well, where I really give some insight on how that business case or that case study worked together with Sanjeev, and it gives you a good view on how, through collaboration, planning, and partnership, we can achieve big results in delivering vaccines in difficult to reach destinations. And I think it was 14 different countries we delivered within 96 hours at the time. That's only possible through partnership and collaboration and planning with all industry stakeholders.
Thanks a lot, Remo. I would like also to come back on this last mile distribution, because we have a specificities in Africa when it comes to remote location. I would like also to have the feedback of you, Anthony, if you don't mind, to share the challenges that you are facing into moving these vaccines and the medical products across the African continent to the last mile.
Okay, thank you so much, colleagues, for joining this discussion, and it's very great. We share experiences here. So my name is Anthony Chirunda. I am the Subnational Activity Manager for the USAID funded Strengthening Supply Chain Systems activity, which is implemented in Uganda by the Management Sciences for Health. I am glad to have been part of Management Sciences for Health for the last 10 or so years, supporting supply chain systems in Uganda since 2010. So there are a number of logistical challenges which are affecting the moving of medicines and medical products across African countries. A number of them, one of which is poor data use. You see, the challenge we have on data use is that it's not very easy to get accurate data on what commodity is needed where. For example, we were having challenges of vaccines, access to vaccines as African continent. But as I speak, we are also, like, for example, case in Uganda, we are having challenges of vaccines having short expiry. And so you have to juggle between the lack of vaccines and now short expiry vaccines. Then the other is we have a number of parallel programs. A number of countries in Africa, Uganda being one of them, formerly, they are having vertical programs. For example, you get the EPI program, that is expanded immunization programs. They are vertical, and then you have the other ones handling HIV, handling malaria, vertical programs, which is a big challenge. And the other is we have insufficient capacity in Uganda, both at national and subnational levels, and across Africa, to manage vaccines, and mainly because they are cold chain, but also purely management of these commodities to ensure we maintain the efficacy of these commodities up to the end user. It's a big problem. And then moving these commodities from the central warehouses to the last mile, to the end user, is a problem to the facilities across. It's a big problem. The road network is quite a challenge. And also we have insufficient fleet, which can manage the cold chain. So it's a great problem. And also warehousing challenges. Currently in Uganda, I think it's only national medical stores which can store vaccines which can go, for example, for Pfizer, which can go up to over negative 70 degrees Celsius. It's only the central warehouse, which is national medical stores of Uganda. And that's a big problem. So we have a number of problems. And also the regulatory services, for example, talking to the National Drug Authority and across the entire continent, regulation of these commodities, how they are brought into the country, the processes are not clear and they have not been harmonized properly. They vary from country to country. Yet here we have to chase a pandemic and all that. And then finally, just shortly, like my colleague there who came from, I think that's Da from DRC, in West DRC, which is Eastern DRC, which is the western part of Uganda, you get a lot of insurgencies there. So moving these commodities through those places to the end user is a big problem. So we have a number of problems that we are going around to see that we can cover and deliver these vaccines and health commodities to the end user. Thank you.
Thanks a lot, Anthony. We are in the middle of this discussion. I guess we've been mainly also discussing challenges, and we have a lot of challenges worldwide, and specifically in Africa. You were, for the last mile, insisting on certain situation, and you also, Anthony, were insisting on the requirements, of course, to comply with regulation, as well as the challenges in dealing with the data. You were rightly mentioning that you have a short expiring date, which is a real challenge to manage, and so the stock and the inventory. I would like to take the opportunity also to hand over back to Sanjeev, also for time reasons. Sanjeev, I would like to hand over to you more on the solutions and opportunities, and you could bring also your conclusion before leaving us, and we will continue, of course, the discussion with the rest of the team today.
Thank you, Fabrice. What I would like to emphasize is that vaccines do not save lives. Vaccination saves lives. And we need to look at the use of technology to actually provide traceability and visibility across the supply chain. And this is a very big problem that we are actually facing in Africa, because there is a lack of traceability. And also when you look at the integrity of the supply chain, especially after the vaccines have left the airport, and to the time they reach the medical centers, we have to actually make sure that we preserve the entire cool chain. And I know that this is something which is being done under a collaborative effort between the Ministry of Health and UNICEF, along with other partners such as Gavi. And what we really believe as the airline is that we only have a responsibility for part of the supply chain. And that is a supply chain that we can actually be able to control. And that is the supply chain which relates to the transportation of the vaccines from one airport to another airport. Now, when you look at an airport like the Nairobi hub, we have approximately 9,000 square meters of cold storage facility at the airside, which can easily handle approximately 25 million doses of vaccines. So what we are looking at is the possibility of using our smaller fleet to transport the vaccines to the secondary airports and to the smaller airports, which do not have the cold chain facility. And I really believe that part of the problem can be solved by using additional air assets. There's also a lot of talk about drones being used for the last mile delivery, which is something which should be encouraged. But what I really believe is the need of how we can use technology, because technology is a very important tool. We're not using technology as much as we should be using in Africa. And if you look at the continent, we were the ones who actually developed the whole technology behind mobile payments. So surely we should be able to now do more about using technology to enhance visibility and traceability. And at the same time, also, we have a very serious situation with expired vaccines. And one of the last things you want is, with all this crisis that we are in, we have vaccines which are expired or which are getting very close to expiry. And in some countries, you're actually seeing a situation where 2 weeks before expiry, they're actually putting their hands up and they're saying, can we take this vaccine and deliver it to another country? And this is exactly what happened in the case of South Sudan and Kenya. So what we are seeing is a vaccine with a very short lifespan and also with some level of cold chain requirement. And what really needs to be able to use technology to preserve the life of the vaccines, but also from a tool for better planning and implementation. So I really believe these are the key factors which are very important at the last mile. And again, we believe that it's still not too late to use technology. We are just at the beginning of the curve, and I'm sure it's going to be a 2-year exercise to provide the life-saving COVID vaccines and all the different variations which will come along the way to and within Africa. And I still believe that we need to reach out to technology partners who can actually be able to come up with this technology, implement it at the local levels so that we can actually have a supply chain that we can be proud of and a supply chain that will actually preserve the integrity of the vaccines. So with that, Fabrice, I really would like to thank you and the panel for my participation. I have to rush to the Ministry of Health for an urgent crisis meeting relating to the current situation in South Africa. And with that, I will be taking your leave, and I would like to request you to please continue and have a great deliberation and a great event ahead. Thank you very much.
Thanks a lot, Sanjeev. Thanks a lot. I appreciate it. If we have to continue, Jean-Cédric, I would like also on this remark of Sanjeev, continue the discussion on what you see still as being positive in your organization in the way you've been distributing a lot of medication, PPEs, but also vaccines in Africa. What would you share as a positive experience and feedback?
I think the example of positive project is quite large. The fact that, first of all, we have not interrupted the supply chain, that I think is one of the first success, and this is really to all the efforts from the industry and from Gavi, UNICEF, WHO, and other partners to make sure that the supply chain is not interrupted. And just to pause, because we are talking about COVID, but the continent has also other issues that we are also making sure that we cannot put behind. Access to school. We need to make sure that we continue delivering school equipment. Health. We have projects on HIV project. We have malnutrition. So it's basically a global effort to make sure that none of these projects are interrupted, not only the supply chain interrupted, while we also scaling up on the response to the COVID-19 pandemic. And then we have maximized all the opportunities. We are digitalizing. The supply chain. We have solutions to also monitor where the supplies are. We have inventories of the different Minister of Health on equipment and on vaccines and devices. So it's really decades and decades of support to the different Minister of Health on the continent through Gavi Alliance, WHO, UNICEF, and all the partners on this panel, but also that we are not seeing currently on the panel. It's really a global effort to support the different Minister of Health in the fight and making sure that health programs are not interrupted. The other successes is the fact that we are working on innovative way. The fact that we have different forums that allow us to exchange on solutions. With Sanjeev and with Hope, with Etihad, we have found solutions to deliver. Anthony was talking about cold chain equipment. Cold chain equipment are coming out of China. We know what's the situation in China. So what we did, we moved a large number of freezers that are too high to go into passenger flights. We moved them to Liège, and out of Liège, through Hope, through Astral and others, we succeeded to have a milk run, basically organizing one charter for 8 different destinations and making sure that we have equipment, UCC equipment, ultra cold chain equipment in most of the central level of the continent. Anthony is right. We are now also sending second wave of freezers for the decentralized level, but this is already this is more for the ultra cold chain. We have done this in the past already for the regular routine immunization with the normal temperature -2 +8 and go to -15. So there are multiple successes. It's sometimes easier to send a full charter to Nigeria than a shoebox of vaccines to Sao Tome. And that basically is a multiplication of effort, multiplication of solutions. And that's why really the industry is one of the main partners here to look at these solutions. Sometimes we are combining sea and air freight. It's really a 3PL solution to basically reach all the different beneficiaries of the continent. So I could talk for hours on success, but also on the challenges, and the challenges are still there. And basically that's why these exchanges on finding solution, on trying to digitalize even more, trying to have better traceability. But really, another challenge that I maybe forgot is due to the turmoil, the prices are definitely increasing, and it makes it even more complex for Ministry of Health to undertake their distribution, for us to deliver the large quantities of supplies. So once again, calling to the shipping industry to continue prioritizing the supplies to fight COVID-19 on PPEs, on COVID-19 vaccines, and on all the devices, because we had to look at new devices. For Pfizer, we're looking at the 0.3 ml syringe, which is basically producing, shipped, and therefore we need to air freight. These are large volumes, and yes, the industry like Hope contributing to this, Etihad and Astral and many others contributing to this joint effort are much more welcome.
Yeah, thanks a lot, Jean-Cédric, also for pointing the positive. I mean, we are into a crisis, that's for sure. And we see that 2 things. First of all, that, you know, the collaboration wording we've been using in the industry for the last 10 years has never been so concrete than the last 20 months. And that's something even at Etihad Cargo or at the Hope Consortium level. So the Hope Consortium is an holistic consortium where you can provide all type of solutions. And this is truly something happening, and you can see it, you can feel it during the conferences, of course, but within your day-to-day activity. And this success that we're bringing, even if challenges are still remaining, of course, are something that we must capitalize on, I would say, and that would serve also the next years in terms of enhancement of the pharma supply chain. I would like also to have your feedback, Da, on what you perceived or on what you achieved over the last months. You were talking before about the challenges, of course, of last mile distribution in your region, in Congo, but maybe you could give us a word about this cost efficiency and impact on the stock availability that you have achieved.
Thank you very much. I think the improved product availability at service delivery point doesn't have a price. It's really the goal of everyone working in public health, everyone working in supply chain, is that the products are available at service delivery point and patient can access them easily. So with this integrated last mile distribution, we achieved this. But on top of that, when we look at the cost back, because we know that the regional or central medical store, when they are doing this distribution, they use the value of commodity. They said, okay, we can distribute this product if you pay us 5% or 10% or 15% the value of the commodity. This is not, I think, the rationale behind it is not really scientific. It is not. It can have a lot of even danger on the central medical store itself, because you can distribute a small package which is very expensive, like Gardasil, and you can distribute huge ballot of LNIS. The volume is huge. The price is low because it's just it's based on the volume. So when we did this in the Hokatanga, for example, based on the cubical meter, it is 6 times less expensive than using the regional medical store. Because what we did, we said, okay, we are not using the regional medical store to do distribution because it's not their really job. The regional stores or central medical store, they can do storage, they can manage commodities, but transporting product from point A to point B is not their role. And we demonstrated that by using this, because we use the private sector to do the transportation. And then we at the end of the project, when we presented the results, it's 6 times less expensive. So that means what? That means that we are saving money that can be used to improve storage condition, to provide technical assistance, to buy equipment. And that's generate really a lot of saving. And in the same time, we are improving product availability. We are reducing stock out. That's what we achieved there. And even we did it, we look at the cost by kilometers, we look at the cost even by delivery by sites, and it's very, very, very less expensive, if I can say, compared to what was done in the past.
Impressive. Thanks a lot for sharing this positive experience also. Remo, I would like also to have a word with you on, the specificity of World Courier when it comes to deliver the medical products into remote locations in Africa. Would you be able to share with us the existing solutions that are put in place?
Yes, certainly, Fabrice, and thanks for the question. And I obviously want to refer to Cedric as well, where he mentioned that we have experience in Africa, and I think from a logistics and supply chain point of view, the solutions are in place and the tools are available to make the vaccine distribution a success, also in lower income countries with challenges of infrastructure. So the knowledge and experience is available in Africa, and we are used to overcome difficult challenges. So I'm very positive that we overcome this together. However, one of the major differences this time is the scale of the operations and the speed of how we need to deliver it. We're talking high volumes and possibly increased frequencies and deliveries. I'd like to refer to the challenge Sanjeev mentioned from integrity of the supply chains. At the minute it leaves the door from the manufacturer until it arrives at the warehouse for final distribution. That's where we can offer solutions from a worker point of view when we're talking packaging devices. So we have a range of own packaging devices available from 12 liters, the shoebox, Cedric mentioned, or even 4 liters, but up to 96 liters on our GTC devices, but also for huge pallet spaces where we can take up to 3 pallets in a refrigerated environment, and we can guarantee the integrity of the product and the temperature range required for up to 96 hours, at some point even over 100 hours. So we have the 4 days of integrity of the temperature. So that's where we specialize in, that's where we have our own solutions, and we need those 4 days, especially when we need to overcome unexpected hurdles, like a delay of a flight, like a road traffic incident or traffic jams. And I think for that we have developed those solutions, that they're in place. And again, our experience has shown that the planning, collaboration, and communication needs to be heavily focused on in order to overcome those shortfall of infrastructures and depending on the individual capability of the country, of course. And as mentioned before, we have offered various solutions, and I think together as a industry we can overcome those obstacles, from bulk delivery into countries and then find distribution into the last mile where it's becoming more difficult.
Yeah, very clear. Thanks a lot, Remo. On your side, Anthony, what kind of solutions do you foresee? What is your, I would say, also positive feedback on what happened to overcome the current challenges?
I was failing to unmute here. Yes, so a number of solutions we have put up, and purely looking even beyond just COVID, okay? But let's first focus at the COVID vaccination issues. So like Sanjeev said clearly, we need to ensure that we embrace technology, okay? We need to ensure that we support computerization, automation of systems, right from the delivery points up to the central level. So for Uganda, what we have done is that as MSH has supported the Ministry of Health to ensure we computerize the system right from the health facilities where immunizations are taking place, so that we can capture that data and it is triangulated and hosted at the center. And that is very good. It is helping us try to look into exactly what is happening at what facility, at what time. Okay, we have not yet done 100%, but at least there is very good visibility, which I would encourage others to embrace. So we have set up a information portal, which is translating all this data. The other is to review and strengthen the existing system. So the current project that we are working with, that is strengthening supply chain systems, is not only looking at COVID. COVID is just one small area of our support here. So we are strengthening the entire system. So MSH set up the quantification team at the Ministry of Health because it was a big challenge to ensure that there is a team which can at least quantify the needs of the country right from the center here. So MSH supported and we set up a team there, and we have actually gone ahead to ensure that that team is integrated. It's now a national team, it's a national structure, and that is what is very good. So there's a team which is looking at quantification for all the products of the country, and that is what we need to be going into as countries. The other is to ensure that we integrate programs. For example, in Uganda, before 2010 and before MSH started supporting supply chain here, there was fragmented systems. EPI, that is for immunization, was parallel, and all these HIV, very separate. Now, what MSH decided to do was to support the system to ensure we integrate. Now, right now, as I speak, vaccines are delivered by national medical stores, which used to be delivered by expanded program for immunization, which was a problem. So now, because we used to have challenges, you deliver vaccines and you do not have even boxes, safety boxes and syringes. So when you integrate these issues, it's very, very good. So that was supported and it's going on. We continue to look and support the national system. The other is to improve supply chain management capacity. We have worked with Courier University, that's the biggest university in Uganda, to develop a supply chain technical assistance program. So they train the health workers to manage health commodities. And now we have also managed to work with even the National Cultural Development Center to integrate supply chain into every health course, so that everyone who goes out there at least knows how to manage a health product, because that was a big problem, and that's what we need to ensure that we support. The other is on transportation. I've had my colleague Jean there talking about bringing on board the private sector. In Uganda, this is something which was done. We supported the national medical stores. We were like, you know what, you have very big trucks. You cannot move to every health facility. So you just move up to the district, and from the district, a private sector can move these products to the last health facility, and that is working, including vaccines. We have a few private sector players who have capacity to even move cold chain commodities. So they are moving, and we need to work with them. So we need to embrace the private sector capacity we have. And the other is warehousing. Private sector still is also helping here, because we have some commodities which are being housed at national medical stores, which is central, and also at joint medical stores, which is private. Also, even in the private sector, we have those bringing on board. So we need to ensure those are brought on board. And the other is to look into the regulatory capacity. We need to ensure we strengthen the regulatory capacity of African countries. They should have capacity to manage and regulate commodity use in their countries. I submit. Thank you.
Thanks a lot, Anthony. I would like now to come to the end of this discussion, in order for each of you, of course, to have few words on what would be your key takeaway, on the current situation and on your understanding on how we can achieve next year distribution. I would like to go invert, and would like to just ask you, Anthony, in few words, how you do see next year in terms of distribution and in terms of enhancements of the current situation, let's say.
Okay, I do see a number of opportunities and challenges to this, because currently, this 1.5 years or so of COVID in Africa has been a learning curve. We have learned a lot, but also the other is that we have seen a lot of, at least access to vaccines has started to improve. So we see ourselves covering a lot. There's a lot to do for us, particularly for logistics, to move the commodities. There is a lot to do there, but at least there is a lot of hope at the end of the tunnel. We would employ systems like, bring on board the private sector, just like I said. That is something we need to ensure we embrace. The other is looking into delivering commodities using like drones, using technology to deliver these commodities. I know drones have a weight challenge. They cannot carry very heavy commodities, but for those hard to reach areas, mountainous areas, they are in the tropic forests like in DRC, in the islands, like in Uganda, we have very many island facilities. So for those, we would employ technology and we make sure we deliver these commodities. What we need to put across and ahead of everything is saving a life. We need to make sure the lives of Africans are put ahead of everything we are going to do, and we deliver. Thank you.
Thanks a lot, Anthony. Thanks a lot for this. Remo, over to you on your conclusion in few words.
Well, thanks for that. And look, it's a pandemic, it's a crisis. If I've learned one thing, it is don't expect anything and just be flexible. So currently I see the biggest challenge, air freight capacity for bulk distribution, but the capacities is there, so I'm sure. So those are the immediate challenges, but the pandemic will go on. And from my point of view, I think, as I mentioned before, planning is key of your supply chain from door to door, including last mile, then choosing the right partners to overcome those challenges, who can anticipate the challenges, who can deliver the quality, guarantee the temperature range. And then during the process, collaborate, be flexible, and together again, I'm very confident that we have the skills here in Africa to overcome this and succeed. But it's far from over and business as usual. It's continued to be disruptive.
Yeah, absolutely. You're right, Remo. I'm totally joining you on this one. Thanks a lot for your conclusion, Remo. We'd like to hand over to Da. What would be your key words?
Thank you very much. I think for us, the key words is sustainability. How can we sustain what we achieved within this integrated last mile distribution? And in terms of, if I can say, okay, building on this to ensure sustainability is the opportunities to do route optimization that will help us reduce more of the costs, and the opportunity to use this last mile distribution to collect consumption data that can be used later on during forecasting and quantification exercise that will improve of course, the forecasting. The use of private sector is also another opportunity, and what we decided in all USAID supported provinces is we are going to use the private sector for transportation. It's going to be an RFP, it's going to be a competition. A regional medical store can participate if they have the ability to do it in the way we want it to be, then they can participate. And if they win, they win. So it's going to be an transparent and open, inclusive process for competition. But the other opportunity is to use the last mile distribution for reverse logistics, mainly because we know that a lot of product waste are collected at facilities. They are like fooling warehouses. So we are using this last mile distribution to do reverse logistics, collect expired, damaged waste from where they are back to the predefined facilities for treatment and for disposal. And thank you. Over.
Thanks a lot. Thanks a lot. And I guess that you're bringing a word which is important. I mean, in all this crisis, everything, of course, is moving in a way fast, but we are facing challenges in which we do have some solutions. Of course, they are still a bit scattered. So this is through collaboration and cooperation that we could manage, of course, to overcome the situation. But in the meantime, I guess during this crisis, we've been learning a lot, and that's certainly the way to go forward. And what you were mentioning on sustainability is certainly and definitely something very important. I would like to give the last word now to Jean-Cédric. Jean-Cédric, in terms of conclusion, what will be your key words?
Thank you, Fabrice. To complement what my colleagues on the panel has said, because I think many good points have already been mentioned, but I think on the upstream, we have only seen the tip of the iceberg. Our objective was 20% of the population. We are now moving to 70% of the population. Many devices will need to be sent, vaccines, protective equipment. 2020 will be plenty of volumes on the upstream part. On the downstream, working with the African Union, working with the Minister of Health, also to facilitate importation. Once we have finalized and identify a flight, having green lights, having complication of import, it's not making our life easier. So really working with the governments to fast track every humanitarian and COVID-related deliveries. Then on the in-country logistics, I think Anthony said it right, and also sustainability. But sustainability for me is working with the private sector to reinforce existing system. It is the Minister of Health that is in the driving seat. It is the Minister of Health that will be there before, during, and after with all the different partners. So our objective is taking acknowledgement of the situation, looking at everything that is possible to fast track the deliveries, to fast track the campaign management, but in support to the Minister of Health, in support to the central warehouse, the central pharmaceutical department, because it's not going to be the last one. It's basically our role is to continuing supporting the different Minister of Health to be able to take care of their own supply chain. And by digitalization, by all the effort of the private sector, by the new innovative ways to reach the different beneficiaries, the health centers, the furthest decentralized health facilities. But it's really looking at the future. We need to have strong Minister of Health to be able to cope with, I hope not the future pandemic, but definitely the future outbreaks in different places of the continent and in the rest of the world. So really thank you to organize this panel and this fruitful discussion.
Thanks a lot, Jean-Cédric. I guess it's a very good conclusion for all of us. So I really would like to thank all of you, dear participants, dear panelists. I guess and I hope we had a fruitful discussion, and that you were able to understand not only the challenges, but also be positive on some solutions which are concrete, already existing, and specifically in certain countries in Africa. Thanks a lot for your attention, and have a good day.